Located within the Kenyatta National Hospital grounds is the National Public Health Laboratory Services (NPHL). A division under the Ministry of Health, it is mandated to perform diagnostic testing, reference testing, disease surveillance, among others.
So the National Public Health Labs is actually only one of our division. We have a department, the Department of Laboratory Services, and this has two divisions. We have the National Public Health Labs, which we are going to refer as NPHLs from now. And then we have the Division of Diagnostic and Clinical Support. So the NPHLs, the reason why it's laboratories and not laboratory, because we have many labs. And these laboratories are actually reference labs. Reference labs are labs that are national. They receive samples from all samples for diagnosis and analysis from private and public hospitals, and sometimes even from individuals. In many cases, because these are reference labs, they receive samples of national public health importance. So this could be epidemics, samples from epidemics, samples from hard-to-treat diseases, samples of diseases that are difficult to diagnose. So the NPHLS also trains, so we have a strong training program, and this training is also for public and private.
As the division celebrates its next level accreditation, we travel a journey of discovery into its history, functions, milestones, and opportunities going into the future.
We have around 7 to 8 national reference labs. I'm saying 7 to 8 because some are units. But the major that I can mention here are the National Influenza Center. Then we also have the National HIV Reference Lab. We have the National TB Reference Lab, the National Malaria Reference Lab, the National Food and Water Safety Reference Lab. Then we also have the National Oncology, that is Cancer Lab. We also have other units like the Mobile Laboratory Units, the National Parasitic and Neglected Tropical Diseases Unit or Laboratory. So these are major, and out of the 8 labs, at least 5 of them have been accredited. This accreditation is high accreditation because we are reference lab. Actually, we put the yardstick. We are the yardstick, and every diagnostic lab in Kenya measures with what we can do. The NPHLS, although it has very many reference labs, there are some of the labs that are very critical. The first one is the HIV lab.
National HIV Reference Lab is a unit within the National Public Health Labs. Its mandate is really to oversee the HIV lab services for in-country, specifically in terms of policies, in terms of QA, in terms of coordination of the testing lab within the country. We have 12 labs doing the viral load and EID testing in country, and it is overseen from this office. We get again panels from CDC Atlanta. This was the first lab to be accredited to get ISO 15189.
Kenya has done very well. A lot of Kenyans who are HIV are actually on ARVs. It is very important to keep on checking whether these drugs you are giving them are working. So in fact, our unit here has a big capacity to do the drug reference. Therefore, we are able to advise the government that this regime is working, this might not be working. We are able to identify patients who may not be responding to diseases for what we can call custom-made interventions. What we want to do is we want to be a WHO recognized and reference lab for HIV drug-resistant profiling. Therefore, even other people from other countries from the region or even international, they can actually refer their samples here. The other thing that is very important in this department is the TB analysis. You know, TB is a big problem, and TB goes hand in hand with HIV. Therefore, we know that majority of people who have TB may have HIV. So it's very important to monitor the two diseases.
The National TB Reference Lab is the apex of the TB diagnostic in this country. So as a national lab, we cover the whole country for TB surveillance and diagnosis. We have a diagnostic in the field where we have GeneXpert as the first entry of TB screening, and we have microscopy for follow-up patient. Back in 2018, the lab was accredited for 15189. After that, the lab have really tried to maintain. You see, TB is airborne. And when you are dealing with the drug-resistant TB, you cannot expose the staffs. So it's like a milestone that the lab has been able to maintain a biosafety level 3 with a negative pressure.
The other one is the malaria lab. Malaria, as you know, is a major challenge in Africa, and diagnosis of malaria is a very important component, leave alone prevention.
The core functions of this reference lab, one of them is policy formulation. We support in developing guidelines for malaria diagnosis. We also develop protocols for guiding the counties in terms of malaria diagnosis. Apart from that, we also do support the counties, that is technical support in terms of quality assurance. Apart from that, National Malaria Reference Lab also support trainings, that is malaria microscopy refresher training. The reference lab has been accredited, that is ISO 17043, as a PT provider for proficiency testing. We are also accredited ISO 15189. As per now, we have the capacity to quality check all malaria rapid diagnostic kits before they are distributed for testing in the counties.
Our mandate is to offer referral services, outbreak investigation, and to oversee quality assurance for mobile lab, for virology. The other function is to offer specialized diagnostic, which include molecular testing and serological testing. We also offer validations of in vitro diagnostics.
This lab was started in 2014 by the Minister of Health with a mandate to do the influenza surveillance, that is severe acute respiratory infections, and also to detect the emerging and re-emerging respiratory infections. For us to do influenza surveillance, we have about 8 sites, we call them sentinel sites, whereby these samples are collected throughout the country. These samples are transported to us on a weekly basis. So we run the test, we do the flu, the PCR, we do the flu subtyping, after which we normally upload our data on the FluNet on a weekly basis. This data is also shared by the Minister of Health for policy decisions, and also we share it with the stakeholders. In 2018, October, we were WHO recognized lab. They recognized this lab as the National Influenza Center for Kenya.
The National Microbiology Reference Lab is a public health laboratory. The key mandate is to offer microbiology services across the country, and also the quality assurance program for bacteriology in the country. The lab is accredited to ISO 15189 since 2016. Up to now, they have been re-accredited and they have been able to maintain the ISO standard. The lab also is accredited to 17043 for proficiency test production, and it's offering the bacteriological proficiency testing to about 27 participating labs.
Functions of the Food Safety and Nutrition Reference Laboratory is to test for foods with an aim to control and prevent the non-communicable diseases which arise from food contaminants and also foods which do not contain the appropriate micronutrients. That is the foods which are supposed to be fortified. We got accredited in the year 2018. The accreditation we really think is a big achievement. It has really helped us in the way we do things within the laboratory. We are recognized as one of the labs within the Comesa region, which is recognized for testing of aflatoxins.
Biosafety Biosecurity unit has been able to really support the accreditation of laboratories. Nothing would have really made us achieve all this if we didn't have a centralized unit that was able to coordinate all these activities so that there's also a standard way of doing things.
The role of the laboratory information, strategic information system or unit is to coordinate data and information. Remember, laboratory generates a lot of data, right from testing samples up to the generation of results. So what the laboratory strategic information unit does is to coordinate this information in terms of making sure that data is submitted to the relevant quarters and in time, making sure that this data is of quality in terms of conducting quality checks to ensure quality of the data, and then analyzing this data using some indices to make sure that this data is consumable by different stakeholders.
The last one that I would like to highlight among many is a cancer unit. Today we know cancer is a big problem in Kenya, and cancer, for a long time, the challenge in Africa for cancer has been late diagnosis. We have realized that it's a major issue in Kenya, and we want to support cancer diagnosis in line with the UHC and also in line with the Big Four agenda. By proper and early diagnosis of cancer, we are likely to cut down the number of cases that have poor prognosis, that is death.
This lab was established in the year 2013 after the Ministry of Health realized that there was no reference lab to cater for non-communicable diseases. So this lab was mandated to be doing specialized tests pertaining to non-communicable diseases. And these are cardiovascular diseases, renal diseases, and cancers, among others. So this lab actually does the biochemistries. It does also the tumor markers for cancers. It does cervical cancer screening, and also it does the immunoassays for conditions like the thyroid function test, cardiovascular diseases, among others. The process of accreditation requires that the most important thing is the patient care, and that is by giving quality result and timely. Again, we are also introduced other methods, the modern molecular methods pertaining to cervical cancer screening. We are right now doing HPV testing, which requires a client to be collected a sample by the clinician and gives results within 3 hours. You can screen more than 200 clients in a day.
The cancer unit, we have an ambitious plan to give it proper instrumentation, to give it new instruments, and also to train staff, and also to even receive more samples.
They say that if you torture the data long enough, it will confess to anything. But as a quality yardstick of public health laboratories across the country, NPHL does not have the luxury of quality compromise.
Quality Assurance Unit has a dedicated staff of quality assurance managers from the various laboratories. Through the dedicated team that works tirelessly to ensure that they achieve their goals, most labs have been able to be accredited. Currently in Kenya, we have 128 laboratories that have been accredited through ISO 15189. We also have a laboratory that is accredited towards ISO 17025 that offers calibration services.
Some equipment need to be calibrated, others need to be certified, others need to be validated. And there was a gap. So when somebody or a team of people sat down and saw the gap, they found it a need to address this gap. We support the other labs by calibrating the equipment. So we service the equipment and then we calibrate. Apart from the pipettes and the timers and the thermometers that are usually sent here, the other equipments we do them on spot. When we go to the county, we use the biomeds that we trained on the county also as a way of also mentoring them. Let the biomedical engineers there, outside there, know that the equipment that need calibrated, they must be calibrated. Because if they are not calibrated, then we are not giving quality results.
Our work here essentially is to prepare panels, that is EQA panels, which we send to the facilities countrywide so that we can have that guarantee that the results that any patient gets in a facility is accurate and correct.
We recognize the hard work that has been put by the quality assurance team, some of them who have left and some of them who are still around, to ensure that we have been able to get the accreditation, especially for the 17043 accreditation that is the first ever in the region. And we hope that we will continue offering the EQA services to the laboratories throughout the country to ensure that they can actually gauge themselves on the kind of the quality of the results that they give to the clients.
The very fact that NPHL currently is able and will continue doing that to offer what we call tiebreaker function. A tiebreaker function means when you come and I confirm that your test is positive, then the positive result remains. For you to do that, you have to be better than almost everybody else.
As the COVID-19 pandemic struck Kenya in March 2020, NPHL swiftly activated its disease outbreak response.
The NPHLS was the first institution in Kenya to identify the first COVID case. And the reason why we were able to do that, in collaboration with CDC and WHO, the National Influenza Center, with its able leadership, had been taken through a lot of training and a lot of mentorship. By the time the first COVID case arose or was reported, the lab was ready.
We were able to pick from the influenza study to COVID very well because we had the systems already in place for the influenza. So that's how we were able to manage to slot in the COVID, which was just a matter of upscaling our testing menu.
We have contributed a lot in the outbreak response, especially using our mobile lab technology. When the outbreak started early last year, immediately we deployed the mobile labs to Namanga and Mai Mahiu, and they have played a very key role in controlling the spread of the virus.
The NPHLS, or my department, coordinate all activities to do with COVID testing in Kenya. We have been able to conduct all supervised conduction of more than 2 million COVID cases, and we have also expanded now testing to the counties. In fact, all the testing labs come to the NPHLS for external quality assurance.
Looking into the future, NPHL envisions more partnerships to amplify its impact, an injection of more human resource, and a sustained support in maintaining achieved accreditations.
Probably what I would like to see is we have all our reference labs accredited, possibly now scaling this up to the county referral labs, so that when we stand as a country and we talk about laboratory services, we can talk of laboratories that measure to the global expectation, and laboratories that can compete with any other lab services anywhere in the world.
The journey started a long time, in fact long before I joined the ministry, and my officers have really worked very hard. There are some people who started this journey, they are no longer with us, and we really acknowledge them, their work and their input. So the issue of accreditation, especially this specific ISO accreditation, which is ISO 15189, it's a unique accreditation. This accreditation will not only give us more confidence to do better work, but it will actually give a lot of confidence to our clients. Along the line, when we were looking for this accreditation, we went through a lot of rigorous evaluation and assessment, and we passed a lot of tests, which are very difficult. And now the battle is actually to maintain that status of ISO 15189.